At University Surgical, it's really a group mentality with everybody from nurses to physicians to advanced care practitioners, the physician's assistants. It's really a group effort, and that continues on. Surgery is important, but the aftercare is almost more important, taking care of patients for weeks, sometimes months afterwards, till they're really fully healed and back to their full function. And that's the real purpose of screening. I think that's a little bit of a misconception with some patients that a lot of them come in and say, oh, well, I feel fine, do I really need to have this done? And the whole purpose of screening is that you're taking people that don't have symptoms and trying to find things ahead of time at an early stage. Because if we can find polyps in the colon, and that's when they're not symptomatic, just purely polyps that are growing in there that people don't know about, and we can remove them right at that time and really prevent a cancer from ever forming. And that's really the benefit of screening is prevention. In my particular specialty with colorectal surgery, it's people often ask, what made you go into this? And it's usually when we're talking about hemorrhoids or something unpleasant that people don't like to talk about. But it all comes back to the same thing, is that, my typical answer is somebody's got to do it. And the reason somebody has to do it is because they're people that are really suffering with these problems. And so that feels very good to be able to help somebody in an area that really is important. Anything from colorectal cancer, which is life-threatening, to something such as fecal incontinence or hemorrhoids, or the things that are not life-threatening, but they really affect people's lives greatly. And so to be able to impact those people, and sometimes it only takes 1 or 2 office visits to make a huge difference in somebody's life, and so that is really what feels great about this field.